Good day, Wonder Nurses. I'm Nurse Anne. Our video for today is all about medical surgical nursing. I prepared 10 nursing exam questions for you to answer and to gauge your knowledge on various med-surg topics. You have 30 seconds in each question, then I will provide the correct answer, rationale, and a short discussion after the 10 questions. So get a pen and paper and let's start. Question number 1. Time's up. Let's now check the correct answer and rationale. For question number 1, osteoporosis is a metabolic bone disorder. Bone resorption is faster than the rate of bone formation, causing loss of bone mass and density. It is common for elderly postmenopausal women due to the decrease in estrogen levels. Other risk factors also include a sedentary lifestyle and vices, like smoking and drinking alcoholic drinks, that can lower calcium absorption. Therefore, the correct answer is C, a sedentary 62-year-old female smoker. Question number 2. A fracture is a break in the continuity of a bone. The manifestations are severe pain, swelling, ecchymosis, deformities, and bone shortening. Since the question is asking for an exemption, the correct answer is A. Concerning fractures or injuries, let me share this acronym RISE that can be used for emergency management. R stands for rest. Immobilize the affected part by putting on a splint to prevent further injury. I is ice. Apply an ice pack to reduce pain and swelling. C is compression. Wrap the affected area with an elastic bandage. Lastly, E stands for elevate. Elevating the injured area helps promote blood flow return to the body. Question number 3. Parkinson's disease is a brain disorder that causes unintended or uncontrollable movements. Its hallmark manifestations are resting tremors, rigidity, bradykinesia, and propulsive shuffling gait. Levodopa-Carbidopa is prescribed to treat the symptoms of Parkinson's disease by increasing the dopamine level in the brain. When your patient is taking this medication, it is important to inform them that their urine will be reddish or brownish. Advise them to avoid taking vitamin B6 supplement because it will affect the efficacy of the medication. Inform them not to stop it suddenly when their condition improves. This is to prevent unpleasant withdrawal symptoms. Finally, advise them to avoid getting up too fast from sitting or lying position. Therefore, the correct answer is B. Question number 4. Guillain-Barre Syndrome is also known as infectious polyneuritis or acute idiopathic polyneuritis. It is an acute, rapidly progressive, and potentially fatal form of polyneuritis or the inflammation of several peripheral nerves that causes muscle weakness and mild distal sensory loss. The exact cause is still unknown, but other possible causative factors are: it is an autoimmune disease, there is damage in the myelin sheath, or recent respiratory infection. Therefore, the correct answer is letter A. Question number 5. Retinal detachment is a serious eye condition that occurs when your retina pulls away or detaches from the tissue around it. Its key manifestations are flashes of light, floating spots or flutters, and a curtain-like shadow over the visual field. Therefore, the correct answer is D, because eye pain is common in patients with glaucoma. If you find our videos or discussion helpful, you can share our channel with your friends so we can help and assist more aspiring nurses. Click also the subscribe button to keep you updated on our latest videos. Let's continue. Question number 6. Meniere's disease is a disorder of the inner ear that can cause vertigo and hearing problems. That's why our priority for a patient with this condition is their safety. So the correct answer is A. Question number 7. Aplastic anemia occurs when your bone marrow stops producing enough new blood cells. Sometimes it stops producing one type only, but more often it affects the red blood cells, white blood cells, and platelets. Since it affects the RBC, WBC, and platelets, the three main manifestations are easy fatigability due to low RBC, frequent or prolonged infections due to the low WBC, and easy bruising and bleeding due to a low platelet count. With regards to health teaching for health maintenance, inform the patient that the treatments for aplastic anemia decrease their ability to fight infection. Thus, it is vital to inform them to avoid large groups of people, especially the sick or infectious individuals. This will lessen the chance of getting infected. So the correct answer is C. Question number 8. Peptic ulcer disease is a condition in which painful sores or ulcers develop in the lining of the stomach or the first part of the small intestine, which is the duodenum. For gastric ulcers, the pain usually occurs during meals or immediately after meals, while for duodenal ulcers, the pain increases 1 to 2 hours after meals or during the night. Therefore, the correct answer is D. Question number 9. The cast is used to protect and support fractured or injured bones. It prevents or decreases muscle contractions and is effective at providing immobilization. If skin irritation occurs, perform petaling. This refers to a method of taping the edges of the cast. So the correct answer is B. Question number 10. Multiple sclerosis is a chronic disease that affects the central nervous system, which is the brain, spinal cord, and optic nerves. Its etiology is still unknown, but the probable cause is autoimmune. Spasticity and muscle spasms are the early signs of MS. To prevent exacerbation-remission of the disease, the nurse should instruct the patient to avoid fatigue, extremes of temperature or climate, and stress. Therefore, the correct answer is B. If you want to learn more about medical surgical nursing, I provided all the links to our discussions and nursing exam questions in the description below to help you. Keep on learning, nurses!
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.